Feel better, live stronger, naturally.
I am Dr. Ijeoma Eziobil, Doctor of Functional and Holistic Medicine. Today's conversation is delicate. It is emotional. And it must be handled carefully. We are talking about infertility, and specifically, how certain parasitic infections may affect female fertility. Let me say this clearly at the beginning. Parasites are not the most common cause of infertility in the United States. They are not the first thing to blame. They are not a universal explanation. But in specific situations, especially chronic inflammation, travel exposure, persistent nutrient deficiencies, or unexplained infertility, they can be part of the bigger picture. And if we ignore inflammation, we ignore one of the core requirements for conception: immune balance. Today, I will walk you through 4 mechanisms: direct pelvic and reproductive organ damage, chronic inflammation and hormonal disruption, nutrient depletion, autoimmune activation. And I'll give you real-world clinical examples so this doesn't stay theoretical. When couples struggle to conceive, we often focus on hormones, age, and anatomy. But what if chronic inflammation and hidden infections are quietly disrupting the immune balance required for conception? Today, we explore the science behind parasites and fertility, not from a fear-based lens, but from a root cause, evidence-aware perspective. Part 1: Pelvic and reproductive organ damage. Let's begin with structural damage. There are very few parasites that directly invade reproductive organs. But one that is well documented is schistosomiasis. This infection is common in parts of sub-Saharan Africa, the Middle East, and some areas of South America. How it causes tubal damage. The parasite lives in blood vessels. It releases eggs. Some of those eggs become lodged in pelvic tissues, including the cervix, uterus, and fallopian tubes. Now here is where fertility becomes affected. The body recognizes the egg as foreign and mounts a strong immune response. Immune cells surround the egg. Granulomas form. Over time, chronic inflammation, fibrosis, scar tissue. And the fallopian tube is delicate. It must capture the egg, allow sperm passage, transport the embryo. When scar tissue replaces normal tissue, the internal lumen narrows. Ciliary motion is damaged, or the tube becomes completely blocked. That means the egg and sperm never meet. Clinical case example number 1. A 34-year-old woman presents with 4 years of infertility. Regular cycles. Normal hormone labs. Husband's semen analysis normal. An HSG shows bilateral tubal blockage. No history of STIs. No history of pelvic surgery. But she lived near freshwater lakes in West Africa during childhood. Further evaluation suggests past genital schistosomiasis. This is not common in the US. But in endemic areas, this is a documented cause of tubal infertility. How parasites block the fallopian tubes. Certain parasites, especially schistosomiasis, can directly cause fallopian tube obstruction. The process involves egg deposition. Female schistosomes lay eggs that can lodge in the genital tract, including the uterus, cervix, and fallopian tubes. The body recognizes these eggs as foreign and mounts an immune response. Granuloma formation. The immune system surrounds the parasite eggs with granulomas, clusters of immune cells. Granulomas are meant to wall off the parasite, but in doing so, they create scar tissue. Fibrosis and scarring. Chronic inflammation and granuloma breakdown leads to fibrosis, replacing healthy tubal tissue with scar tissue. Tubal scarring narrows or completely occludes the lumen, preventing sperm and egg transport. How parasites. Inflammation can also cause pelvic adhesions, connecting the tubes to surrounding organs. These physical distortions further prevent the egg from traveling to the uterus. Why this happens, mechanisms. Immune overreaction. The body produces cytokines, TNF-alpha, IL-1, IL-6, in response to eggs. Chronic cytokine signaling promotes tissue remodeling fibrosis. Chronic infection. Persistent presence of eggs sustains inflammation over months to years. Longer exposure, more severe scarring. Secondary bacterial infection. Damaged mucosa and immune disruption can allow bacteria to colonize the reproductive tract. This intensifies inflammation and accelerates scarring. Here are some of the consequences. Partial blockage, delayed conception, ectopic pregnancy risk. Complete blockage, infertility due to inability of egg and sperm to meet. Chronic pelvic pain and irregular bleeding may also occur. Now let's move to pregnancy viability. Another parasite you may hear about is toxoplasmosis. Important distinction. This does not typically cause tubal blockage. It affects pregnancy more than conception. If a woman acquires acute infection during pregnancy, the parasite can cross the placenta. It can infect the fetus. It can trigger miscarriage. Chronic latent infection is less clearly associated with infertility itself. Now let's look at clinical case example number 2. A 29-year-old woman experiences 2 early miscarriages. She recalls a flu-like illness during her first trimester. She had recently cleaned a cat litter box without gloves. Testing reveals recent toxoplasma exposure. This is about pregnancy loss risk, not failure to conceive. That distinction matters. I am Dr. Ijeoma. Thank you for being part of this podcast. See you in part 2.
Feel better, live stronger, naturally. Shepherd's therapy.